Hi, this is Dr. Brian McDonough. It's the new normal, looking at other health issues in a COVID-19 world. The most common question that I'm getting as of June 11th, which is a Thursday, repeatedly is it safe to come to the office and be seen? Is it safe to get a procedure done? Should I get that preventive study? What can I do? Now, obviously, I can't speak for every healthcare facility around the country and certainly wouldn't even try. In addition to that, I can't also tell you what your specific region of the country is doing at a specific time with regard to allowing you to come in or not. Let's start with the simplest answer. If you have a healthcare provider, a physician or other who has telehealth, that certainly is a great option where you can talk about the medicines you're on, the refills you need, how to get them. You can also talk about if you've fallen behind on preventive screening. For instance, do you need a mammogram? Were you expecting to have your cholesterol done? Are you going to get a hemoglobin A1C? I mean, all those different things can be talked about quite easily through a telehealth visit. So that might actually be something convenient for you. And around the country, that's being paid for. Doctors are learning how to use it. It's actually a pretty cool tool. I hope it never goes away. I think it's the future of medicine. What about coming in? Well, what you need to do is ask specific questions. Now, remember, a lot of healthcare facilities, especially hospitals, are getting in front of this. They're advertising, you've probably heard throughout the country, we have a COVID-protected environment, a COVID-safe environment. You will be okay when it comes to COVID. What they're really saying is they're limiting the number of people who can come. They're either testing people who are coming, or they're checking temperatures, or they're limiting the number of people in waiting rooms. The obvious fact is you can't even go to the store theoretically and not be exposed to COVID as long as there's other people. And if people aren't being tested 100% efficiency, it's there. But what they're doing is they're dramatically cutting it down. And we now have so much knowledge about wearing masks, social distancing, and the fact that if we cut the spread from droplet nuclei in the mouth, we really can make a big difference. Also reducing length of time of exposures. So all of that being said, I think it is safe to go back. You have to decide what is the importance of what you're doing and why. And I think that is, from a health standpoint, a question that you need to ask to your doctor, your healthcare provider, or if it's a facility you're going to, ask those questions. This is not a time to be shy. I mean, if you've gotten through it thus far and you've done the quarantine and you've done all the other things, ask the necessary questions. And as I keep telling you, there is information you can find and you can read, but there's a lot of people who are wishing COVID away right now. And I think we're going to have a backlash with that. But that doesn't mean you have to be impacted. And that's what I'm worrying about. Those who see this not getting exposed. And remember this, if you happen to do something which puts you at risk, if you were in a large crowd of people and now you're having second thoughts, get tested. Because if you're positive, you want to reduce that risk of spread to others. That's how we can take care of this. And there is testing available throughout the country now that you should be able to get. You can check with your public health organization where you live and check with leaders. I hope this is helpful. Again, this is going to be the future of the videos I'm doing. I will not be doing them on a daily basis, but just when things come up that are important, and hopefully you can look in this direction. Please stay safe.